Live now to Canberra to the Prime Minister.
Medical Officer and General Fraun, we have to be very clear about our objectives. This is a key point of discussion we had with Premiers and Chief Ministers today. What is it that all of these measures are designed to achieve? That was set out very clearly in the National Plan. That objective in this phase of dealing with the pandemic is to minimise serious illness, hospitalisations and fatalities, and to maintain those baseline restrictions to support that goal. So the idea that our measures as governments across the country, Commonwealth and at a state and territory level, is to prevent everyone in the country from being infected with the virus, that is not the objective. That is not a realistic objective. It's not a practical objective. Nowhere in the world are they trying to achieve that virtually. And that is not something that we are trying to achieve. What we are trying to achieve is to ensure that we can keep our hospitals under the least pressure that can possibly be put on them, that we can maintain the strength of our hospitals through this pandemic. And we recognise that, of course, our hospitals and our health systems are under significant strain at present. That is unavoidable when you have a pandemic operating at this scale with this latest variant of the virus. The pressures on the hospital system is things that we have been working to ensure that we can cope with for a very long time. And hospitals, again, despite the pressures are there, and I thank all the staff who are working in those hospitals who are under significant strain. But we are, at this stage, continuing to manage the number of cases coming into hospitals within those tolerances. It's not easy. It's putting a lot of pressure on people, but it is being achieved. And that remains a very important objective for all of us as we continue to manage this pandemic. The other thing we're trying to do at exactly the same time is keeping our economy functioning. Now, this is a closed system. It's a finite system. As we've progressed with the Omicron variant, which, remember, has two key characteristics. The first one is it's highly transmissible, and the second one is it's less severe. Now, both of these facts, particularly the latter one, it wasn't till several weeks ago that that was able to be confirmed. And so the suggestion that somehow restrictions may have been lessened earlier when we had no clear evidence at that time that the severity was less would have been a very, very unwise decision. And that's not the decision we took. Once we became aware that the severity was less, then that has enabled us to move to ensure we can relax some of the restrictions in critical workforces. And so this is a constant daily process of balancing the need to keep people at work and to protect our hospitals. And that's why it changes almost daily, because this balance changes daily. We will go through a period where this peaks, and then we'll be into another phase about how we're managing it from there on. And different states and territories will enter those peaks at different times, but they will enter that peak, and they all understand that. Some sooner than others. It's possible that New South Wales may have already passed it, but we'll see as the weeks unfold over the next little while. So the key point we wanted to stress today, and that I want to stress today, is this is a constantly moving target. We know what we have to hit: keep our hospitals going, keeping our health system strong, and keeping as many people at work. The less restrictions you put on people to get them at work, the more pressure that can potentially put on your hospital system. And vice versa. The more you try to protect your hospital system, the more people you're taking out of work, which disrupts supply chains. So this is a very delicate balance that needs to be constantly recalibrated. And so today, I think, was another very good discussion in getting those trade-offs right and making sure we get those trade-offs in place. The workforce implications was a critical discussion today, and I'll make some further announcements about what was agreed. But just let me remind people about the decisions that we've already taken. The redefinition of close contacts is still only quite recent. And through the meetings of the National Coordinating Mechanism led by Joe Buffoni, with the support Oversight Minister of Karen Andrews, we are already getting feedback that those measures, particularly in the supermarket distribution systems, are already having a positive impact. But we need to go further. The close contact rule, remember, is that you're a close contact if you have someone in your own accommodation setting that has the virus, okay? That's when you're a close contact. You're not a close contact because you happened to be here today and one of you might have COVID. You're not a close contact if you've gone to a bar or to a restaurant or another venue and there happened to be a case there. This notion of exposure sites, which means you're a close contact, that's Delta. That's in the past. Close contact is if you're living with someone in an accommodation type environment and you're in that situation for that protracted time. That's if you're a close contact. And of course, the other one is you're symptomatic. And if you're symptomatic or you're a close contact, you should get tested. And you go to the testing centre and they'll either give you a rapid antigen test or they will give you, and all free, a PCR test, depending what is necessary in both of those cases. Now, the biggest armoury we have to fight the virus is the vaccination. And yesterday, as General Fruin will outline, we had the best day on dose administration since I think it was the 5th of October. We had 349,000 doses administered yesterday. Now, of those, 254,112 were boosters, and that's tremendous. That is absolutely tremendous. We had, in total now, with 5 to 11-year-olds, we have got 141,587 doses administered to children aged 5 to 11. Now, that's in 3 days over 6% of that population. And those doses continue to roll out, and there's 1.1 million children's dose vaccines on shelves, in fridges, in those more than 6,000 points of presence where people can access those vaccines. Could I also remind parents with children age in the secondary school age to go and get theirs. So the 12 to 15-year-olds, we've already passed the 80% first dose for that group. We need to get to the second dose. We're over 75%, so we're closing in on it. So a reminder, it's not just 5 to 11-year-olds that are on the back to school list. Make sure for the 12 to 15s, if they haven't had their second dose, to go and get those as well. I also want to note that reinfection on Omicron can occur. So all this nonsense about COVID parties, it's ridiculous. Okay, reinfection can occur with Omicron. And so if you think you can go out there, get the virus and get it over with, that's not how it works. That's not how the virus is writing the rules. So continue to take the precautions, continue to exercise common sense, continue to be responsible in managing your own health and the baseline measures that are in place to support you and the health of others. Today we agreed the concessional access to rapid antigen tests, which will commence on the 24th of January after discussions with the Pharmacy Guild, and that will be done on a 50-50 basis. The pharmacies will source those supplies and you'll be able to get it along the terms that I announced last week, and I thank the states and territories to their agreement on that. That will be funded 50-50 under the COVID Health Agreement, Partnership Agreement. And so that is, just to be clear again, 10 tests in total over 3 months with a maximum of 5 a month. And you go to the pharmacy, you present your relevant concession card, which we have announced before, and they can process that and provide you with that test from the 24th of January. Obviously, supplies are limited, just as they are for the rest of the community, and that's those arrangements. We also discussed the key priorities for rapid antigen tests, particularly those provided publicly, and they are, firstly, the health and aged care workforce. Commonwealth, of course, looks after aged care, and the states and territories looked after the health workforce. And for symptomatic and close contacts, which is provided through the state testing centres. And thirdly, for vulnerable communities. So that's particularly Indigenous communities. And a good note there, just like 12 to 15-year-olds, our double dose vaccination rate for Indigenous communities has now gone over 75%. Our first dose has also crested 80%. And that's a tremendous result in Indigenous communities. And I want to thank particularly all of those in those Indigenous communities and Indigenous leaders for the great work they've been doing right across the country. To further ease the pressure on supply chains, we extended the easing of restrictions for close contacts. So that's the one which enables someone who may be a close contact, they get a negative RAT test and go straight back to work. They don't have to isolate for that period, they just go straight back to work. The most immediate extension of that is to all transport, freight and logistics employees. So not just those directly involved in food distribution, but all in the transport, freight and logistics sector. And that also will include those who work at service stations to ensure that they continue to be staffed and people can get access to those services. We will also be extending it to, if it hasn't already been done, and in many cases it has, it will cover all health, welfare, care and support, emergency services, which includes law enforcement, correctional services, energy, resources and water and waste management, food, beverage and other critical goods supply, so that's the food distribution system and production system, I'm not talking about hospitality there, telecommunications, data, broadcasting and media. And it will also extend to education and childcare, but I'll address that separately now. Well, before I do that, let me note that the Commonwealth has already lifted the 20-hour rule on student visa holders. That decision's already been taken. That was taken yesterday, after the meetings we had yesterday. So students will have no hour restrictions on them being able to be available for work in Australia if they're already here. I also note that students can return. That's been in place for some time now. Backpackers can also come to Australia now under those work and holiday visas. So they're able to enter the country, both of which, students and backpackers, if they are double vaccinated. And that is a necessary condition for entry into Australia. But moving back to schools, one of the most important ways of ensuring that our workforce is not depleted, and we heard today from the Treasury Secretary that we could be looking at an up to 10% absenteeism from our workforce at any one time at its peak. That's 10% of your workforce taken out by COVID. Now, that is the impact of a highly contagious infection and virus. And that is going to have an inevitable impact on your workforce, and then that has to be managed. If schools don't open, then that can add an additional 5% to the absenteeism in the workforce. So it is absolutely essential for schools to go back safely and to remain safely open if we are not to see any further exacerbation of the workforce challenges we're currently facing. So schools open means shops open. Schools open means hospitals are open. It means aged care facilities are open. It means essential services and groceries are on the shelves. That's what schools opens mean. And it's very important they go back. And the health advice is they can go back. And the Chief Medical Officer may make further comments on that. We agreed some key principles today, and they are, and next week the detailed operational plans will come back, which will deal with the role of surveillance testing, with rapid antigen tests where that's deemed necessary. It'll deal with how that applies to staff in particular. It'll deal with mask wearing, and those arrangements are being worked through by the states and territories now. But the first principle is that childcare and schools are essential and should be first to open and last to close wherever possible, with face-to-face learning prioritised. Now, we note in particular in South Australia and in Queensland, they have delayed the full reopening of schools by 2 weeks. That is on the basis of the estimated peak of the virus in those states and to align those opening times around that issue. So there is some specific medical reasons while they are doing that in those 2 states, which is recognised and understood by the other states and territories. But we note that in both of those cases, those states will have the ability for children of essential workers, which covers all of those groups I mentioned before, to be able to send their kids to school on that day. So they are still addressing the key workforce need, and we hope they'll be getting as best a possible education for the children of those essential workers when they go back. The baseline public health measures continue to apply. That no vulnerable child or child of an essential worker is turned away. That responses must be proportionate and health risk-based. That childcare services and schools are equipped to respond on the basis of public health advice with support from public health authorities where required, and the wellbeing of children and education staff to be supported. So supporting essential workers in education and childcare will be important, and the Commonwealth and the states are working together to have 50-50 funding arrangements in place to ensure that is put in place, certainly by the time school comes back, and we'll have a bit more to say about that next week. Not unlike how last week we talked about concessional access, we're able to detail those plans over the course of this week and bring them into agreement now. So a fairly busy day with the focus very much on keeping Australians at work and keeping Australians out of hospital. We keep achieving that as best as we possibly can. That enables us to push through. That is done through a combination of getting people vaccinated, ensuring we continue to have sensible precautions in place and those public health social measures in place, whether they be in schools, workplaces or anywhere else, and that can limit. But the goal is not to stop everyone in the country getting COVID. The goal is to protect our hospitals and keep our society and economy functioning as we ride this latest wave of Omicron.